Fans were shocked when longtime Jeopardy host Alex Trebek announced he had stage 4 pancreatic cancer. The 78-year-old optimistic, he says he plans to fight it, but the diagnosis is bringing awareness to the cancer. Joining us to talk about some of the symptoms and treatment options, Dr. Shanel Bhagwandin from Jupiter Medical Center. First of all, thank you for taking time out of your busy schedule.
Thank you for having me.
Let's talk about this. First of all, start at the beginning. What does the pancreas do?
Right, so the pancreas is a digestive organ primarily. It allows us to digest fatty foods. In addition to that, it allows us to regulate hormones throughout the body, specifically insulin, to monitor and regulate our blood glucose. So that sort of leads into the two different types of pancreas cancer that you can develop, one from the endocrine and one from the exocrine, which refers to the digestive side.
Yeah, certainly not something we think about on a day-to-day basis,
right.
But when we're talking about that, it's such a diagnosis it's kind of scary, you know what I mean? It can spread fast. What are the symptoms of pancreatic cancer people should be looking out for?
Yeah, so they're very vague. A lot of it is certainly the awareness of paying attention to any sort of change, but primarily we are seeing patients that have low back pain, abdominal pain, very vague symptoms, unintentional weight loss. In addition to that, patients will eventually develop jaundice if the cancer is in the head of the pancreas, so yellowing of the eyes and skin. Okay. And one thing that's been recently purported is sort of late onset diabetes. So we're seeing patients that are diagnosed after the age of 50 with diabetes, and sort of in a 2 to 3 year interval, there's sort of a change in the milieu of the pancreas that predisposes to that development of cancer.
Why is it so? It seems like pancreatic cancer, that diagnosis, that's a tough diagnosis. Why is that versus other cancers? It's so much more worse.
It is an aggressive cancer. When it's diagnosed, as a cancer surgeon, I primarily treat cancer with surgery, but only about 20% of the patients that I see with pancreas cancer can ultimately go to the operating room because of how aggressive it presents, as you mentioned. Why it sort of presents in that way is that at the time of diagnosis, this cancer, even from a cellular level, has really taken on growth, invasion, and can certainly spread throughout the body to different parts of the body, in fact, where you can't really get control of the disease. It's also very difficult to treat once it's at that stage with regards to chemotherapy, radiation, etc.
It's kind of in the middle of everything,
For sure.
To put it in a layman's term. Any people that are more at risk of developing pancreatic cancer than others?
Absolutely. So risk factors, we see patients that are smokers are higher risk. Certainly diabetics, late onset diabetics, as I mentioned. We have about a 5 to 10% chance of developing sort of hereditary pancreas cancer, or with certain genetic makeup, those patients can certainly lead to the development of pancreas cancer.
Sure.
And in addition to that, other risk factors are primarily sort of, what we talked about with regards to hereditary pancreatitis, in fact.
Well, it's in the headlines because of Mr. Trebek, and we wish him a speedy recovery. Absolutely. And we thank you for coming in, explaining some of that, kind of putting it in simple terms so maybe we can get ahead of it if your family member or maybe yourself are seeing some symptoms.